Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Anti-inflammatory and anti-neoplastic drugs. As a well-rounded healthcare provider, you know that corticosteroid therapy is indicated in all of the following conditions except Option A. Osteoarthritis. Option B. Rheumatoid arthritis. Option C. Systemic lupus erythematosus. Option D. Acute spinal cord injury. Right answer is Option A. Osteoarthritis. Osteoarthritis is not an indication for corticosteroid therapy. It has an inflammatory component, but the disease is not severe enough to suppress the immune system. Lupus, spinal injury, and rheumatoid arthritis are conditions that require suppression of the immune system in order for the client to survive. Oral steroids are prescribed on a taper in order to Option A. Achieve optimal serum levels. Option B. Ensure drug reliability. Option C. Ensure compliance. Option D. Prevent steroid withdrawal syndrome. Right answer is Option D. Prevent steroid withdrawal syndrome. Steroids are tapered off in order to prevent a withdrawal syndrome. Optimal serum levels do not require tapering in order to be maintained. Tapering has nothing to do with drug reliability. Compliance is not dependent on tapering. Orlando, who has been taking steroids for rheumatoid arthritis over several years, presents with a compression vertebral fracture. This fracture is due to Option A. An entirely separate condition. Option B. The osteoporotic effect of long-term steroid use. Option C. Deterioration in rheumatoid arthritis. Option D. An excessively high dose of steroids. Right answer is Option B. The osteoporotic effect of long-term steroid use. In a client on long-term steroids, a compression vertebral fracture can be assumed to be due to the steroids' bone softening effect. Tom is admitted into the emergency department with an acute spinal cord injury. Methylprednisolone is contraindicated for treatment when the injury Option A. Is a high cervical lesion. Option B. Occurred less than 4 hours ago. Option C. Occurred less than 8 hours ago. Option D. Occurred more than 8 hours ago. Right answer is Option D. Occurred more than 8 hours ago. Research has shown that steroids are ineffective when given more than 8 hours after acute spinal injury. Which of the following statements about intravenous administration of steroids is true? Option A. Steroids administered intravenously must be diluted. Option B. Steroids administered intravenously can be either in diluted or undiluted form. Option C. Steroids should be given for push only. Option D. Intravenous administration of steroids is contraindicated in acutely ill clients. Right answer is Option B. Steroids administered intravenously can be either in diluted or undiluted form. IV steroids can either be diluted or given without dilution. Teaching has been adequate when a client being treated with acetylsalicylic acid states. Option A. I can crush the pills before I swallow them. Option B. I should take the pills with antacids. Option C. Taking the pills on an empty stomach will help absorption. Option D. If the pills smell like vinegar, I should throw them out. Right answer is Option D. If the pills smell like vinegar, I should throw them out. Any aspirin should be discarded if a vinegar odor is noticed. Crushing is not recommended for sustained release preparations. Antacids impair absorption. Taking the medication on an empty stomach will increase GI irritation. Which of the following laboratory tests should be monitored when a client is receiving azathioprine? Option A. CBC. Option B. BUN. Option C. Electrolytes. Option D. Sedimentation rate. Right answer is option A. CBC. CBC will identify leukopenia, a common side effect. Gold compounds are contraindicated in clients with option A. Liver dysfunction. Option B. Cardiac disease. Option C. Pre-existing dermatitis. Option D. Rheumatoid arthritis. Right answer is option A. Liver dysfunction. An adverse reaction to gold compounds is liver toxicity, therefore, use care in clients with pre-existing liver dysfunction. Nurse PI is instructing a client receiving probenecid, Benemid. She should cover all of the following information except the need to. Option A. Change dietary habits. Option B. Increase fluid intake. Option C. Have frequent laboratory work done. Option D. Recognize side effects. Right answer is option C. Have frequent laboratory work done. Side effects of probenecid treatment are relatively benign, and there is no indication that there is a need for frequent laboratory evaluation. Which of the following is the priority nursing diagnosis for a client undergoing chemotherapy? Option A. Decreased cardiac output. Option B. Fear. Option C. Altered nutrition. Option D. Anxiety. Right answer is option A. Decreased cardiac output. Decreased cardiac output is more important than the other choices because it can jeopardize the client's life. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.